202, again, slushy, but we're getting ready for another round, and that's going to cause that ice that's on the ground already, Mike and Alex, to kind of freeze up.
Yeah.
And then, of course, the snow will pile up on top of that.
All right, everybody, that was some winter weather coverage from our sister station, Fox 29 Philadelphia. And I do want to interrupt here because we like to bring live guests on our show to really break down the latest headlines, especially the coronavirus pandemic. I am joined right now by Dr. Arielle Levitan. She joins us live from Chicago. Dr. Levitan, how are you this morning?
I'm pretty good, thanks. How are you?
I am great. We appreciate you joining us here on NewsNOW from Fox this Monday morning. We are here to talk about, the side effects of COVID-19 vaccines. They are becoming more readily available to the public, and it appears that when people are getting them, they're starting to suffer flu-like symptoms. So can you kind of explain, as a medical professional, what you are seeing right now?
Sure. So actually, a lot of our experience with the COVID vaccines comes from other healthcare workers like myself, because we were all in the first group to receive the vaccines, and we have, quite a bit of experience with this now. What we often see is soreness in the arm, as one can get from any injection, but I would say it's perhaps a little more common with these. It can last for up to several days after the injections, and it can even come on a few days later. The arm can be red, sore, but usually taking your typical over-the-counter pain relievers such as Tylenol can help with this symptom. Some people do get other symptoms such as fevers, chills, a general sort of malaise and achiness, what you would describe as flu-like symptoms. This is not because you have an actual virus. It is just a side effect from the vaccine. And it, in fact, is a good thing. It means that your immune system is responding to the vaccine. It is doing exactly what it is supposed to do in relation to stimulating an immune response. And we just sort of encourage people to recognize that this is normal, and it does go away. It does improve also with Tylenol. Sometimes people take Benadryl as well, but those things help ease those symptoms.
And Dr. Levitan, I feel like a common misconception or confusion really right now is if anybody is feeling any sort of symptoms, side effects, how do you differentiate whether these are flu symptoms or symptoms of COVID-19?
Well, it is challenging because, again, these symptoms do mimic a viral syndrome. So some of it is you have to look at the context and the timing. If your symptoms start almost, immediately or within 24 hours of receiving the vaccine, most likely it is related to the vaccine. However, if there's a significant delay, more than a few days, and if you have other symptoms such as, more of a cold, cough, sore throat, those kinds of things, then it's time to think that maybe there is something else going on. And of course, these days we're very cautious and recommend COVID testing, when there's ever any doubt.
Now, how can we minimize these post-vaccination symptoms? Is there really any way to even do so?
Well, I think in general, going into the vaccine, well rested, well hydrated can make a huge difference. We recommend, really pushing fluids around the time of the vaccine, as well as electrolytes and, the right vitamins and minerals to stay hydrated. And then should you develop the symptoms, then we do recommend taking things like Tylenol, again, sometimes Benadryl if there's an issue with itching or redness around the site, or for any potential allergic reaction, which is very rare. So those are the big steps to take. And of course, listening to your body and resting if you feel under the weather after the shot. But in my opinion, these things are all tolerable. They do go away in time, and it is well worth having a few days or a few hours of ill effects to avoid a life-threatening illness.
And now a lot of the people receiving the COVID-19 vaccines right now, or at least first priority, are people 65 and older. Is there any more of a risk, or is there anything else elderly people should be doing differently if they experience these symptoms?
As far as we know, there is no increased risk to the vaccine based on age. Older people have the same, risk for side effects as younger people do, and many of them seem to tolerate it very, very well. So in my professional opinion, especially in this population, it's important that they receive this vaccine because they are at the highest risk for the complications of the COVID illness. So therefore, any potential vaccine side effects are largely outweighed by the risk of having a serious illness. So we very much encourage our elderly patients to get the COVID vaccine at any possible opportunity.
Now, Dr. Levitan, I see that you were the co-author of a book that really breaks down how people can avoid these misconceptions about vitamins and keeping your body healthy. What does the information in your book say, and how does it relate to being in a COVID-19 pandemic?
Yeah, so we definitely believe that vitamins are an important part of everybody's health. And at VuVitamin.com is a great place to get more information about how you specifically can get the right vitamins for your individual needs. Vitamins are an important part of staying healthy and keeping your immune system in good shape. We've known for years that vitamin D, for example, plays a very important role in immune health, and a lot of recent research surrounding COVID has actually borne this out for us. We've found that people who are vitamin D deficient are much more likely to have severe cases of COVID, and therefore we recommend that most people take some vitamin D on a regular basis to keep their immune system at its best. But that amount should vary from person to person, and it depends on a lot of different factors. So that's why we actually created VuVitamin to help people figure out which vitamins and in which amounts are right for their individual needs. Because we're all different, right? We have different diets, lifestyles, we have different health issues, and things like that. And all of those factors help us determine which vitamins we should be taking to stay healthy during a pandemic or in other times.
All right, Dr. Arielle Levitan, is there anything else you'd like to add? If people need to take away one thing from this interview, what do you want them to know?
I would say that you should be proactive about your health. That includes taking the right vitamins. Again, you can go to VuVitamin.com for more information on that. But in terms of the COVID situation, we strongly encourage everyone to get the vaccine if they have the opportunity. There are mild side effects that are well worth it to help prevent this really potentially life-threatening illness.
All right, Dr. Arielle Levitan, thank you so much for joining us live here on News Now from Fox with this great insight.
Thanks for having me.
Absolutely. Well, a big thank you to all of our live guests that join us here on News Now from Fox, taking a live look now at the White House. A bit of a